Then in January of 2020, so this is like a year later, we moved 2 hours away from where we used to live. I was doing pretty good. I was getting back into like working out, and I was a lot healthier. I could breathe after only 2 treatments. The pandemic hit February of 2020 here in Utah. That's when it hit. In June of 2020, I realized again I wasn't breathing right, and we had been on a hike and I wasn't able to get in breaths like I had been the past few months. So I had kept the same doctor throughout everything, even though we had moved. He wanted to do an echo to check on my heart, a CT scan, and then we would do a PET. So we did all of those, and on the PET scan he saw something again. With this surgery, it was with I just love my doctors. With this surgery, I went to the same thoracic surgeon. I love him. He's amazing. A nurse told me once he's like one of the best thoracic surgeons in Utah, and it was just like really lucky that I got him that day. But he did my surgery again, and he actually had to go in the same exact way as he did on my last surgery. So this is the 3rd surgery he's done on me. So he had to go in from the left. He went in the same exact like scars that I had and everything, cuts, and he went in the same way, dropped the slung again to get into where it was lighting up again. And it wasn't the same exact area, but it was around the same area. But this time my body really couldn't recover from that. So I had been admitted to the hospital alone because it was just after the pandemic hit and no one was allowed to come with me. And after surgery I had another chest tube, but with this one I had my chest tube in for 4 days. It was so uncomfortable and I was in so much pain. It was like one of the hardest things, especially because I was alone. But I had a lot of people that were FaceTiming me like all of the time, and that was really nice because I was freaking out. I mean, I love the little Asian lady that came in to do my blood work at 3 in the morning. But I really didn't want to be there anymore. So I got that surgery done last week of July of 2020, a year ago now. And I was re-diagnosed July 28th, which is actually today. So a year ago today, I was diagnosed the 2nd time with the same cancer. So again, same area, same cancer, everything. And so the next thing that we did was another port surgery. So I got another port put in, so that same area, and this one came outside of my body. And that's why there's this like scar that kind of looks like it's hanging out, because that's where it was rubbing against all the time, and where like the tape and glue stuff was put down, which I was allergic to that stuff. And every time they peeled off the bandages that covered it, they'd peel off a layer of my skin every time. So that was really uncomfortable. Sorry, this is so long. Hodgkin's lymphoma and being diagnosed again. The next step is to do a bone marrow transplant. You can't, like, from what I know, you can't just do chemo again. It has to be a bone marrow transplant. Before transplant, you need to do 2 infusions of chemo to put you in like remission, which you're not really in remission. It just gets you ready for the transplant, like clean for the transplant. They were going to do ice chemo for me, and that's pretty normal for Hodgkin's lymphoma. For those, you need to be admitted to the hospital when they do the chemo, and it's only for like a few days that you're supposed to be in there, and then you can go home, and then you'll come back for the second one, and then you would have your transplant. So for me, that did not happen. So I went in, I was admitted, and again I was admitted alone because of the pandemic. Told me that this chemo was super tolerable. Yes, it was a lot more toxic than the first kind of chemo that I had done, but it was very tolerable with everyone. They'd never seen anyone react to it. And so, you know, I just had to be that patient that had a super horrible reaction to it. And they started the chemo, and I was so blessed that my nurse, I had been like chatting with, I'm a pretty chatty person with other girls. And so when she was like getting me all hooked up and starting my chemo and everything, we were just talking, and she had stayed a little bit just to chat with me when usually she would have left because it's so tolerable, and like they just start it and then usually just leave so that it can just do its thing. But luckily she had stayed because I like immediately could not breathe. And so I had actually coded on the chemo. Again, it was lucky that she was in there because as soon as it hit my body, the chemo like through the tubing, I told her I cannot breathe, and then I was done. Like I couldn't talk, I couldn't like see, I couldn't even like function. And so she called the code. The next thing I remember seeing was so many bodies in this tiny room, and it was very scary, especially because I was alone. And I do remember when I got a little bit of breath back, I told a nurse to not let me die. So yeah, that's a little bit of my coding story. After I coded, they wanted me to stay in the hospital for obvious reasons. And they wanted to try me on a different regimen. This was after the doctors went back and talked to each other, and the transplant team, I should have started with this. The transplant team for Utah is different than my oncologist that I had worked with previously. So the transplant team is just more specialized, and it's not one doctor. Nobody that works with the transplant team has one doctor. It's actually a team of 12 doctors, 11 doctors, and then certain little groups of those transplant team doctors kind of specialize in certain cancers. So there's a few that work and had studied Hodgkin's lymphoma a lot more than like leukemia. But then the leukemia side, there was a lot of like more specialized people in each kind of leukemia. So you never got the same doctor, so there's not like my doctor at the transplant floor because they rotate all the time, and they work as a team on everybody. However, I did tell them I wanted I call him my primary oncologist now because he's like my primary care doctor. I don't even go see a primary care doctor. I just go see my oncologist. So he was always kept up to date. He always knew what was going on. I always talked to him. I had appointments with him, and not just the transplant team, because I trusted him and I knew that he would give it to me straight, and he doesn't scare me into certain decisions, and he respects me, and yeah, those types of things. So obviously I coded on that chemo, and so we needed to try a new chemo because I still needed to have 2 treatments before doing transplant. They switched up the chemo, and they actually changed it to 2 of the chemos that I'd be getting later with my transplant, which really scared me because one of them was in the mixture that I had just coded on, but they believed I had coded on some other part of the mixture that wasn't the actual chemo. It's just the housing solution that it was kept in. And so they said, we'll switch out which one, the housing solution it's in. We're going to try this chemo again, those kind of things. So imagine being alone in the hospital, having just coded, and the doctor's telling you they want to try the same chemo again to see if you code on it and have a reaction to it. I was very scared. But this time they were so nice, and they kept someone in the whole time. They brought a crash cart in. They laid out all of the like reaction meds right by my bedside. It was so nice and just so thoughtful of them. I was like freaking my pants. But I didn't have a reaction to those, and it was kind of nice because with the second treatment I could actually do it as an outpatient, so I didn't need to be admitted. August is when I did my first chemo. September my hair started falling out. September 18th I did chemo number 2, so my second infusion of that chemo. September 28th I went into the ER because I wasn't breathing again, and it was really bad. Like, I was super short of breath and everything, and it was pretty painful. I went in and they found I had pulmonary embolisms, and they were making their way up to my sweet heart. And you could die from that stuff, so that was really not good. But I'm glad that we caught it and everything. I had that in between my chemo and my transplant, and then I did my stem cell collection in October. They give you a ton of meds to stimulate a ton of stem cells because I was my own donor. I didn't have a transplant from anyone else. They could use my own cells, clean them for Hodgkin's lymphoma. I have no idea about leukemia and all of that stuff. But for me, they could use my own cells, which is such a blessing because it's a little bit more tolerable. It has lower risk for graft versus host disease, which is super common in regular transplants. They pull it all out of you, take it from you, and then put your blood back in and all that stuff, which is super uncomfortable, and I got pretty sick from it while doing it. And it's like you're sitting there for hours, and you have to get a certain amount, or you have to do it a second time, or they don't have enough to do the transplant. I'm super stubborn and they said that if you don't go to the bathroom or something and you just sit there as long as you can, you get a better collection. And so I drank no water. I did not get up to pee once. I was like, I am freaking doing this one time. And so I did. So after my stem cell collection, well, I shaved my head in October as well. And then November 9th is the day that I checked in for my transplant. With a transplant, you need to be admitted onto the transplant floor because your immune system goes to nothing. You have zero. You can't fight off a common cold. You can't fight off anything. Checked in on October 9th. I was allowed to have one human being be my visitor, and that is the only person I was allowed to ever let to come and see me. So it wasn't like I could change people every day. The plan was to have Logan be my person to come up and see me and whatever, but he actually went on like a work trip kind of to Texas for a week, and he actually ended up getting COVID on that trip, which obviously he cannot come see me when he has COVID and I'm getting a transplant because I can't fight it off and I would die. So my mom had always planned to come and be with me that first week while I was there, and they actually let me do that because I had talked to them beforehand. She was with me all of my infusion, and she was there every single infusion. The first time I was diagnosed, she was with me at the hospital every single time. So we started chemo on that November 9th. Beam chemo. That chemo lasted about a week, I think, and it was every single day, 2 times a day. So that's a lot of chemo, and this chemo is a no joke kind of chemo. It's like the most toxic chemo that you can get because if you think about it, they have to kill off everything. They have to kill all of your stem cells, like everything in your body, in order to give you a transplant. It's like a brand new baby is what they told me. So I did that chemo, and then I had a day off from chemo before my transplant. November 17th is the day that I got my transplant, and they call that your birthday because you're reborn, you have a new body, you have, obviously some other people would have new blood types and everything. Obviously, I wasn't like that because I had my own blood cells. So with my transplant, all of your counts go to like 0. Your body stops producing everything because it just stops producing everything for you. Like I was getting transfusions. I was getting platelets. I didn't get them as often as some other people because my body started working pretty quick after my transplant, and where it started to like, okay, we need to start working now. Like the week following my transplant, I was alone for a few days because my mom had to go. They were super nice again to let me switch out my sister. Granted, all of these people had to go get COVID tests done and then isolate right before they came to see me. My sister came up and stayed with me like in the hospital, like sleeping in the hospital, and my mom had slept in the hospital with me as well. She came up for like Thanksgiving time, but in between that switch, I got really sick. I was like passing out a lot. I wasn't able to walk alone. I really couldn't function, and so that's why my sister had come up, because my mom had left and I really needed someone there. It was just so nice because then someone could like help me get to the bathroom and help me to like get things that I needed just randomly around the room. So I was released from the hospital November 28th of 2020, and I'm now 8 months past that point. I don't have any more appointments with the transplant team because they're not my doctors. My primary oncologist is the one who I meet with all the time, who orders my scans and all of that, because the transplant team, they only saw me for like 3, maybe 4 months, whereas my other doctor has known me for 3-4 years at this point, and so he knows more about my body, more about me as a human, all that good stuff. He's watching me super close, and I was able to get my port out. I did it pretty quick after my transplant. I think I got it out in, I want to say December. That's all I wanted for Christmas because I hated, it was so uncomfortable. My skin was just, it was going nuts, and I just wanted to shower normal. This might be too much information, but after transplant, they want you on a ton of medications. They want you on antibacterials and anti all these things, all these different things, which makes sense because when you're released from the hospital, you have a little bit of immune system, but it's not crazy good, obviously. So they want to put you on all these things to make sure that you have a little bit more support to fight off things like that. And especially with COVID still going on, they just wanted to make sure. I did try all of that medication for a few weeks. They had me on it all during transplant as well. But I felt horrible. And so I personally worked with my doctor to see if there's other options for those medications, different brands, different kinds, those kind of stuff. And we tried those, and I still felt horrible on all of them. I made the decision to stop all of that medication. The transplant team was not happy. When I was trying to tell them that I wasn't feeling good on it, when I was still going to get blood tests. So I was still working with them a little bit after my transplant for maybe a month, just so they could watch my body, platelets, levels, stuff like that, in case I need transfusions. I was telling them that I really wasn't feeling good on this medication, and I had tried not taking some of them and taking some of them, and then going a few days on nothing. And I told them the drastic difference I felt when I had stopped taking the medication for just a few days. And it was literally like night and day. How clear my head was, and my stomach didn't hurt, and oh my gosh, it was like so many different things wrapped up. And the transplant team hated that I did not want to take this medication. I had a doctor full on trying to scare me into taking some of these medications, and he went worst case scenario and telling me the surgery they would have to do through my eyeball if I got one of these viruses and all these types of things, which is super messed up. And so if you have a doctor like that where they're just trying to push you into doing something because they're right, that's not okay, and you need to go talk to a different doctor. I went and talked to my primary oncologist, and that man is amazing, because all he does is he says, okay, I'm so sorry that you like are feeling these things, and we tried different medications and I was open to that, but I was still feeling the same on all of the other ones. So he said, okay, look, these are the facts of what could happen with not taking the medication. Here are the facts if you do take this medication, and the success percentages, which were all around 50-50. Okay. It was hardly giving me a higher percentage than if I like hadn't been taking it. Like it was so close. In my mind, it was way too close to be going through that much pain and discomfort and just being sick all the time, and I just wanted to recover. I've had cancer twice. I just wanted to have some time to recover and get healthy, and so I personally stopped all of my medication. I just wanted to make note of that, because a lot of people think that they have to take medicine because their doctor is telling them to, when I don't believe that. I believe that you know your body, and yes, you need a medical person to give you the facts and the information, because we obviously don't know about that stuff. But then it's up to you, and you know your body, and you know the risk that you want to take. From my pulmonary embolism, I took my blood pressure medicine. Obviously, I don't want to let one of those things go up into my heart, but I got to a point, my doctor said I could stop taking that. So I'm not on anything now, except for like my vitamins that I would be taking normally. December 20th is the day that my trauma pretty much started. I mean, let's be honest, I've had a lot of trauma in my life, but that's the day where it just like had a bomb go off. I had started meeting with a therapist in January, and I've been working with her January 2021. So I have been meeting with her ever since then, and I love her. She's amazing. She's helped me so much, helped me work through a lot of the trauma that I've had. I started, like I mentioned in my last video, I started EMDR, which is not easy. And I go through like spells after EMDR, and it's only been like a few weeks. I just don't function a little bit, which is fine. That's the point of it. I mean, in my mind, it's just like chemo. It's gonna get really worse, or it's gonna get a lot worse before it can get a lot better, and before you can heal. So yeah, that is my cancer story, and it's a lot of things, and that's not even like half of the things that happened. But I'm losing my voice. I did like post pretty consistently on my Instagram, and on my highlight bubbles you can actually like see me in the hospital or see me recovering and that kind of stuff. As of now, I'm 8 months post-transplant, which is amazing. I feel super healthy. Like my body feels super healthy. It's like physically gone back to where I naturally should be. Like not super swollen all the time. I'm just back to my regular human size, like without a bunch of crap going in my body. Granted, it's still there. The chemo will be in there for years and years and years to come, because that's just how it works. So my next scan is in September. So, and that's a CT scan. So from that, they'll tell me that I'm clear, because from things that have happened and with my personal testimony of Heavenly Father, I know for sure that my cancer is not coming back. That is personal revelation that I have had, and I keep that very close to my heart because I've done it twice. When I got diagnosed the second time, I needed help to get through the second time and not to be alone through that. Yeah, that's pretty much it. And that is all I have today. If you have questions or stuff like that specific on my cancer journey, I can definitely answer those. I'm gonna get back on track. I want to do a video a week, so that's my goal. So I'll see you guys next week. See ya. Bye.